Great. Well, while we wait, I can get started and doing some basic introductions. I want to thank everyone who is joining us today to learn a little bit about what we've done as the network and as part of We Breathe with developing a policy platform and creating a list of recommendations that has been community informed and supported through extensive research and work to better understand what are the priorities for our communities in addressing tobacco use among LGBTQ people in California. And so I also want to thank my co-presenters that will be introduced soon. But yeah, I think we can get started. I'm happy to start it first and provide some context as to who I am and who We Breathe is and the network. I'm part of the California LGBTQ Health and Human Services Network that leads the We Breathe project. The We Breathe is a program funded by the California Tobacco Control Program through Prop 56 funds to provide technical assistance, educational resources and materials, research and data, and capacity building opportunities to help reduce LGBTQ health-related disparities in California. And so, Shannon, I'll let you take it away with introductions, if you'd like.
Yeah, so I am Shannon Kozlovich, she, her, hers pronouns. I am a scientist and an LGBT activist and a tobacco prevention enthusiast. So I also sit on the policy platform committee who put the policy platform together with We Breathe. And that has been an amazing experience. And I'm looking forward to sharing with you everything that we put together. I'll go ahead and pass it to Kim.
Hey everyone, I'm Kim Homer-Vagadori, she, her pronouns, and I'm the project director with the California Youth Advocacy Network. We're also one of the statewide programs funded through the California Tobacco Control Program to ensure that young people are involved in leading the movement to end the burden of commercial tobacco here in California. And I'm also the co-chair of the We Breathe Advisory Committee and served on the policy platform subcommittee as well.
Hi, everyone. Good afternoon. I'm Ian Holloway. I'm a professor of social welfare at the UCLA Luskin School of Public Affairs and past TRDRP grantee and the director of the UCLA Hub for Health Intervention Policy and Practice. Our vision is that communities hold the power to shape their health and well-being, and we strive to co-create research to achieve that aim. And pronouns are he, him, his. Delighted to be with you. I was also a member of the subcommittee for the policy platform.
Great, thanks everyone. And again, my name is Isaias Guzman. My pronouns are he, him, his. I'm the manager of programs at the network and have helped lead the We Breathe program and coordinate efforts in developing the policy platform. We also have representatives from the California LGBTQ Legislative Caucus, as well as a special guest, Assemblymember Christopher Ward, who is the vice chair of the caucus, who will be speaking with us shortly. And yeah, so I don't know if you wanted to introduce yourselves, Alina, or if you're okay.
Happy to introduce myself. Hi, my name is Alina Hernandez. I am one of the consultants for the California Legislative LGBTQ Caucus. I'm on the assembly side, so I do work under Vice Chair Ward. I've been with the caucus since 2017, so we've had many encounters with We Breathe, and very excited to be here today and partner. Thank you.
Great. And
Yeah, with that, I'll go ahead and take the mic from you, Isaias. So We Breathe is funded by the California Tobacco Control Program. and as one of the statewide priority population coordinating centers. This program is funded by tobacco purchase tax dollars, and there's a coordinating center for a variety of priority populations throughout the state of California, such as African American, Black, Hispanic, Latino, some Native American, Indigenous, tribal priority population groups, and then We Breathe, who serves the LGBTQ plus community. When We Breathe started putting the policy platform together, we found out that we didn't have access to the kind of data that a lot of other priority populations did, because data on tobacco use and research on reasons behind tobacco use and the best ways to prevent it for LGBTQ plus communities has not been consistently or systematically collected over decades, the same way that it has for a lot of racial groups. So when we were putting the priority platform together, we had to shift our focus from what do we know works to what do we know impacts LGBTQ plus tobacco use. And that is particular to topics surrounding the social environments that we live in, the political or policy environments that we live in, the economic environments, the historical and cultural systems of oppression that are placed on LGBTQ plus people, and any other intersectional identities that we may hold that do impact the tobacco that we use. So a lot of questions that I've received throughout the years that I've been doing tobacco control work, particularly in LGBTQ plus spaces, surrounds why tobacco. If we could go to the next slide, one of the biggest reasons is because LGBTQ plus youth use tobacco at higher rates than straight and cisgender youth. And a lot of this is because we lack supportive services, an increase in bullying and isolation, and just a lot of things that get placed on youth that are particular to LGBTQ plus youth that lead to tobacco or other substance use. And that persists throughout our lifetimes. So LGBTQ plus adults, are also at higher risk than non-LGBTQ plus adults for tobacco use. Many of the data that we look at in terms of both adult and youth tobacco use in LGBTQ plus communities primarily looks at LGB, or lesbian, gay, and bisexual youth, and sometimes leaves out counting or making visible the use of tobacco among transgender youth and adults, which then causes a lot of the numbers to likely be lower than it is in actual use numbers among our total community. So we had to go out and talk to community members in order to put this policy platform together. The group of us that were on the steering committee for this could not do it ourselves. We had to reach out to LGBTQ plus tobacco researchers like Ian and other tobacco LGBT researchers throughout the state of California. We had to talk to community members. We had to look at our resource centers, other tobacco control grantees, because LGBTQ plus communities exist in all other priority population groups, which means that we need to know what is the impact of race and other intersectional identities on tobacco use among LGBTQ plus people. And we took all of this feedback and we put it together in our policy platform and came up with some very key and necessary findings. The findings showed that what we really need is to address the root causes of LGBTQ plus tobacco use. We need to look at the fact that our communities have a hard time accessing healthcare, whether it's because we are uninsured or if it's because affirming care and our identities and whole selves being affirmed and welcomed into medical spaces is not always accessible to us. It also has to do with employment. A lot of LGBT people still, even in California, show up to work afraid of coming out at work or being outed at work, or the stressors that come behind transitioning during employment, and all of the other factors that come in with bias and microaggressions faced on a daily basis. And this remains true for access to housing. LGBTQ plus people live in houses, and so we would like to remain having access to housing. We're also overrepresented in lower income or lower socioeconomic brackets of the population, which means that LGBTQ plus people have a harder time having housing security. We have more food insecurity. A lot of the people that we interact with on a daily basis, whether it is at work, in our personal lives, in the doctor's office, when we go to apply for WIC programs or Medicaid programs, a lot of the people that we interact with just have a general lack of cultural competency or cultural humility when it comes to working with our communities and understanding what our identities are and how they impact how we access and engage with social programs or engage in our lives in general. And one of the biggest factors in this, and one of the biggest things as a scientist, in my opinion, that is missing for our community is research. LGBTQ plus people exist within every single research study that is looking at human beings in the United States and here in California. Yet questions about sexual orientation and gender identity rarely show up in research for the general population. And we would like to make sure that we are counted, because all of these issues are LGBTQ plus issues, and all of these issues are reasons that LGBTQ plus people use tobacco at higher rates than our straight and cisgender peers. So with that, I will go ahead and hand the mic back to Isaias for introducing our guest speaker.
Yes, I just noticed. Yes, perfect. So we also have a guest speaker today, Assemblymember Christopher Ward, who is the vice chair of the California LGBTQ Legislative Caucus, and who can share a few thoughts and opinions on LGBTQ and tobacco control and tobacco use.
Thank you. That's my cue. It's really good to be with you, dropping in right on time. It is a busy time up here at our state capitol. We're bouncing between a lot of committee meetings, but I didn't want to miss the chance to be with you today, and just grateful that we're having this work session as well. I know there's a lot of panelists here that I wanted to acknowledge, and really your organizations as well. For Isaiah Guzman from the California LGBTQ Health and Human Services Network, Kim Homer Bagadori with the California Youth Advisory Network, Dr. Shannon Kozlovich, our consultant for science and policy, and Dr. Ian Holloway with UCLA. Thank you for bringing us here together today. I did want to note and really want to be thankful for We Breathe for working on this conversation. We know that the full extent of the LGBTQ tobacco-related health disparities is difficult to highlight because of a lack of visibility in our community and some of the research and health data collection. But we also know that our community does have significantly higher rates. How much higher? That's very difficult to pin down a specific number, but we know this is an specifically important issue for our community. Some of that recent data shows that our communities use tobacco at higher rates than straight and cisgender counterparts, maybe due because of the stressors of experiencing discrimination or harassment in employment, or education or healthcare or other settings, and particularly for our youth. We know that generally, well, LGBTQ or otherwise, that when youth are impacted or youth are addicted, it just gets that much harder for somebody over their lifespan to be able to beat that addiction. And so when we see that LGBTQ youth are vaping at twice the rate of straight cisgender youth, possibly due to family rejection at home or bullying or discrimination at schools, or other things that they need for crutches, they turn to substances like tobacco for comfort and support. And in addition to all that discrimination and harassment and oppression, LGBTQ people are impacted by housing insecurity and food insecurity, unemployment, access to education, access to affirming healthcare and affordable healthcare. So these all really compound some of the challenges people have, the stressors that people have as a uniquely LGBTQ issue that would lead our youth otherwise to an increase in tobacco use. So really focusing on this, the root causes, and trying to end our LGBTQ tobacco epidemic, it's going to require addressing a lot of the social and political environments that impact and lead to some of the health and well-being of our communities. And they recognize that our LGBTQ people, of course, exist within all California communities. So working together and really having these conversations like we are here today, and importantly, the support that we are seeking, the advocacy that we are seeking here to be able to perform legislative and budget action to address the underlying issues and the issue directly itself, that is critical. So I just wanted to, really close briefly and thank you for your leadership in that advocacy space and helping us advance a lot of the LGBTQ health and wellness initiatives. And I just really encourage you, please, to keep it up. We have a challenging year ahead of us for a lot of the support that we know we need to get back out from the state to our home communities, but we will figure that out. And it requires that the budget is really a matter of priorities. So we've got to make sure that our voice is loud and strong. And I know that the 12 members, we actually are the first state in the country to achieve 10% of the legislature that is commensurate with the general population identifying as LGBTQ. And the 12 members of the caucus here will stand united with you in elevating these budget priorities as well to make sure that our community is not left behind. So I want to, again, if you have any questions or issues, I, really encourage you to reach out to my staff for those assistance, but we're really happy to be a partner with you in the work that you're doing today.
Assemblymember Ward, thank you so much for being here with us today and just the support that you show for LGBT tobacco use overall. Your leadership is just amazingly appreciated.
Happy to be of service. Thank you.
Well, I know you have committee meetings to attend, so I don't want to hold you up too long. But again, like Shannon said, thank you so much for making time to speak here. We really appreciate it and appreciate your leadership on these issues. With that, we can continue with the presentations and have the conversations that Assemblymember Ward already laid out for us. Like, what do we need to do to work towards ending the LGBTQ tobacco epidemic? And Shannon, do you want to take it away?
I will. So our policy platform comes down to being able to fit a lot of the recommendations that came out of it when we put together conversations with researchers, community members, and LGBTQ+ community leaders. We can kind of fit those into 3 buckets that we're here to share with you today. The first will be Ian Holloway, Dr. Ian Holloway, who will talk to us about how we can best support LGBTQ+ research and what that means and looks like. We'll move into talking about restorative justice and the role that that plays in tobacco use among LGBTQ+ people as a whole, and particularly focusing on our youth, to make sure that we're preventing the start of tobacco use at early ages. And then we will have a conversation about how we can best fund our own LGBTQ+ organizations, who are the ones that are on the ground doing a lot of the amazing grassroots work that we have. And in our restorative justice and LGBTQ+ organization topics, you will hear from Isaias and Kim in all of the experiences that they have. But for right now, I will go ahead and hand it to Dr. Holloway to start us off on the research.
Thank you so much, Shannon. And please, everyone call me Ian. I'm so delighted to be here and to be a part of this group. So I'm going to start off by talking a little bit about the challenges that we have in understanding the contours and dynamics of tobacco use among LGBTQ plus communities, which really stems from lack of data. So like Assemblymember Ward highlighted, we know that there are elevated rates of tobacco use. How those differ across sub-communities or subgroups of LGBT people is something that still needs to be investigated. We don't know much about the ways in which policies that are passed at the state level, at the local level, impact tobacco use specifically among LGBTQ plus people. And really importantly, we have very few effective cessation interventions for LGBTQ plus tobacco users who want to stop smoking. So we need research on prevention, we need research on cessation. There's a lot that needs to be learned about how LGBTQ plus tobacco use plays out on the ground. And if you could advance to the next slide, Isaias, that would be great. So one of the major challenges that we face is that we don't have great data. And although SOGI data collection, sexual orientation and gender identity data collection is mandated for public health surveillance in California, we know from our work with Health Access and others that this often tends to be quite spotty. And so one of the things that we're advocating for in the policy platform is to streamline and systematize collection of SOGI data. And We Breathe and the coalition is here to support folks who are interested in working on that process through technical assistance, through training, and through the development of standardized practices and protocols. Next slide, please. This slide further emphasizes the importance of the standardization of data. So as I mentioned, implementation of data collection practices is one of the big challenges that we face. We saw this play out during the COVID-19 pandemic, and the ways in which sexual orientation and gender identity were collected in terms of case reporting of COVID, COVID vaccination, and COVID death reporting were woefully lacking in terms of helping us understand how COVID disproportionately impacted LGBTQ plus people. We have a similar challenge with tobacco use when it comes to public health surveillance. And so our goal is to streamline data implementation, data collection practices, and analyzing and reporting, and we can do that through the standardization of measures, which again, our team is happy to support. Next slide, please. So Shannon laid this out really clearly during her time at the beginning of our hour. LGBTQ plus people exist across contexts. We're everywhere, and oftentimes because of lack of data collection, we're rendered invisible. All research projects, regardless of the topic area, should have data collected about sexual orientation and gender identity. And so that's one of the key pieces of one of the key recommendations that we're pushing forward in this policy platform. We need to be counted in order to develop evidence-based interventions and policies to benefit our communities. Next slide, please. So if we haven't already made the case about why SOGI data collection is so important, it helps us to understand health inequities and address those health inequities. Ultimately, that will improve health and well-being for LGBTQ plus people as they exist on their own and in relation to our cisgender and heterosexual counterparts. And an important thing about asking those questions, which sometimes is overlooked, is that when you have a question that asks someone what their sexual orientation is or how they identify in terms of their gender, it acknowledges and affirms their experience, which means that they're feeling included even in the process of data collection, and are therefore much more likely to give good, accurate data that can better inform health outcomes, as well as lifting them up as a human being. Next slide, please. So all data collection efforts matter, whether they're big or small. I know we have a diverse set of collaborators in the virtual room here, but whether you're working for a community-based organization, whether you're working for legislative staff or in some sort of academic setting, needs assessments, the types of data that you're collecting internally and externally for your organizations, and certainly state-funded research projects should mandate the collection of SOGI data. And regardless of the size of the research project, that representation is so important. And as researchers, we have the ability to pool data across research studies in order to develop more robust findings. And that's what that technique of meta-analysis is all about, is taking findings from various sources and trying to extend them so that they have a broader impact. So I'll just invite anyone who's in the room and interested in learning more about best practices for collecting SOGI data to please follow up with us. I'll put my email in the chat, and I know Isais has a way for you to follow up with all of us, but we're happy to do that consultation and technical assistance. And I just have one more slide that I'm going to present, and it highlights this idea of a couple more slides. Sorry, got ahead of myself. It highlights this idea about how LGBTQ plus research is funded and the different models that we use. So one of the standards that's been moved forward in the last decade or so is around community-based participatory research, or CBPR, which encourages researchers to include community perspectives and do their work in partnership with LGBT researchers and community-based organizations. If you could go to the next slide, Isais, we'll talk about how our policy platform extends this even further. We're advocating for community-led research projects, and this movement is just starting in the national sphere, and we hope that we can bring it here to California. We're encouraging for funding of community-led research projects where the ownership sits with the community-based organization, and the researcher comes on in a consulting role or as a key partner. And oftentimes there's a tendency to fund researchers at academic institutions to then go into communities and try and answer these important research questions. But our model encourages community-based organizations to be at the center of that process, to educate researchers on the key priorities, whether those are programmatic priorities or policy priorities, from the community perspective, and then to allow the funding to sit with the community-based organization. And so the researcher must work in partnership, a true partnership with those community collaborators. And now I think I have one more slide, which is on the importance of intersectionality. So this is a term that many of you have heard about as it relates to research. We all come to our daily lives with intersecting identities. Our sexual orientation, our gender identity are two of those, but our race, ethnicity, our ability status, many other myriad identities are part of how we experience the world. And so we're really encouraging to use that intersectional lens, not only as it relates to individual identity, but how it relates to structures of power and privilege and oppression. And so we are advocating for research that really takes a critical analysis of who has access to power and privilege as a result of their intersecting identities, and how we can actually develop programs and policies that meet the needs of people who may have less access to power and privilege. And we know that that's certainly the case for many sexual and gender minority people, many LGBTQ plus people. So I think from here, I'm handing it over to Kim for the next set of slides. Thank you very much.
Great, thanks so much, Ian. So I'm going to shift our thinking a bit, and we're going to look at specifically what can we be doing, what the policy platform team also really wanted to focus in on how can we really uplift LGBTQ youth and provide more of a supportive framework rather than criminalizing young people who use tobacco and nicotine products. I want to start to just by noting that the tobacco industry actually uses that as one of their talking points, as one of their strategies, is to place the blame of addiction and use onto the individual who uses the product instead of onto the companies who mass produce and sell death and disease. And so instead of focusing on tobacco use as an issue of enforcement, we really have to be reminded that this is a public health crisis, and especially when we're looking at young people. I want to note that in 2018, we were talking a lot about a youth vaping epidemic. For the last few years, we've also been talking about a youth mental health epidemic, and they've really come together. And we're seeing that right now in the data that we have to show the impact of tobacco products on youth, and also to show that LGBTQ youth have the highest rate of tobacco use of youth populations here in California. And so it's really important to know that when young people are using these products, they're more likely to be sought out by law enforcement because of use or possession. We do have policies still in place that allow for criminalization of youth who are using substances. And so if we know that more LGBTQ youth are using tobacco, again, they're more susceptible to those enforcement measures versus the public health measures. And then just even removing substance use in general, we also know that LGBTQ youth and youth of color are more likely to be criminalized both on K-12 campuses as well as in the community. And so again, it's really up to us to shift that focus so that we look at our youth partners as those that we want to support to figure out this problem and to end these disparities that exist instead of looking at young people as the problem. Next slide, please. And so before I really jump into some of the solutions, I want to circle back to something Assemblymember Ward said that I think is really important. He had mentioned that LGBTQ youth are more likely to be bullied. And there's also specific data that shows that transgender students in school settings are significantly more likely to experience bullying and harassment and to be at fear of physical violence than cisgender peers. That's important because when we look at root causes of tobacco use, we have to understand that LGBTQ youth are more likely to use tobacco for a variety of reasons. Part of that could be the fact that the bullying, the harassment, next slide. And then also we have to look at exclusion. And we know, unfortunately, that schools are excluding LGBTQ youth, and not just in the actual space, but in textbooks, in representation of teachers and adult partners who are on school campuses. So we have a lot of work and opportunity that we can be doing in school settings to be more supportive and to provide more resources to LGBTQ youth. And so again, it's shifting our lens and how we engage young people, how we support young people and create safe spaces rather than criminalize or continue to hurt youth, and to use those K-12 settings so that we prevent the school to prison pipeline that unfortunately is all too prevalent today. Next slide. And so with that, I want to talk about some of the solutions that are highlighted in the policy platform. So the first is really recognizing that law enforcement should not be part of prevention work in school. So in California, there is funding for school resource officers to be doing prevention work within schools. And so really the focus here is that that funding should be going to prevention, it should be going to education, it should be going to intervention, it should not be going into enforcement. That the funding through our tobacco tax dollars here in California really should be used to be uplifting young people and preventing initiation and supporting quit attempts, rather than finding youth who might be using products on campus and getting them in trouble, detention, suspension, whatever that might look like. That's actually a very common practice unfortunately, in our schools. And that's something that we really need to focus on changing. And instead, working with law enforcement to enforce the retail space, to make sure that retailers are not offering products or selling products to youth, that they're not selling products they shouldn't be selling. We do have a new flavor ban in the state of California, so ensuring that they're in compliance with local, state, and federal laws. Next slide. And with that, we have an incredible opportunity to create alternative to suspension programs in our K-12 schools. So what that means is that if a young person is identified as being somebody who is currently using a substance, if they're maybe vaping on campus, they're in possession of a product on campus, that instead of sending them home and suspending them or putting them in detention, that it's actually creating models and finding supportive adult partners on campus or even peers who can welcome in that young person, understand more about their behavior, understand why they are using those substances, and then either link them to culturally appropriate cessation services or support them in getting to a point of wanting to make a quit attempt. What we are doing right now is, again, we're demoralizing them in many cases by just sending young people home and telling them you're the problem because you were using the product on campus, and instead of really understanding why they're using the product and supporting them in quitting. So there's a lot of different ways of doing this. There's creating learning models to support young people. We have an incredible opportunity to partner with community-based LGBTQ organizations to create mentorship opportunities, to uplift youth, specifically LGBTQ youth in school settings by offering internship opportunities, mentorship opportunities, community service opportunities to, again, support youth in recognizing the behavior, understanding their own addiction, and supporting them in quitting. And I want to note, and I think that this is going to be something that Isaias talks about. I know that Ian also mentioned this. I believe Shannon also mentioned this. But it's really important that not only when we're investing in these services to our youth partners, but if we're inviting an LGBTQ organization to come into this space and do this work, we should also be funding them for their time to provide this support. And this is a really good opportunity to work with LGBTQ elders to share stories and really foster communities of belonging and understanding for youth. And so with that, we can also fund student organizations. So gender and sexuality alliances on campuses, we can support young people in advocating for these groups to actually form on their campuses and to have a safe space where they can be there and meet together. It's important also to support the adult partners who are those safe allies of young people on campuses, and to ensure that if there are intervention services, we also should be all advocating for intervention services on our school campuses because they don't exist on many, but making sure that the counselors or the school psychologists who are providing those services, if they're not culturally competent to do so, that they are referring out to a local LGBTQ center who is. So again, it's not just offering the services, but ensuring that the adults or the peers who are offering those services are safe and trusted partners for those young people. Next slide, please. And then I just want to loop around. We've been talking a lot about schools as well, but I want to note in California since 2016, when the legislature passed our Tobacco 21 law, they did remove the youth purchase, use, and possession language from our state law. But it does not preempt local jurisdictions from having those laws, we call them PUP laws, in their local ordinances. And unfortunately, it's not uncommon to hear of local jurisdictions who are adopting a new tobacco retail license or updating an existing one to try to add back in those PUP policies. The idea, again, is that youth are the problem. We're placing the blame on the young people who are maybe buying or using using the product instead of placing the blame on the tobacco industry and the harm that they are causing, and the fact that they are creating these youth-friendly products and marketing them to young people online and in community spaces. And so instead, what we need to look at is how do we remove that language from our local jurisdiction and not, again, allow that interaction between law enforcement and LGBTQ youth and also youth of color, and instead focus our funding and our efforts on making sure the retailers are following local laws and that we in public health are doing public health and doing intervention and supporting young people in quitting. Next slide. And so I just want to close out my talk by recognizing that this work is happening around California. And yesterday in Sacramento, our organization was so excited to bring close to 500 youth and adult partners together to do a march and a rally and a press conference on the west steps of the Capitol to highlight the incredible work that local organizations are doing in our state. This was a fully youth-led event. Our youth partners came up with this logo and the slogan this year, really wanting to recognize that the tobacco industry is still the enemy, that we collectively have to fight for health equity. And in doing so, we need to restore our communities and restore the young people that we are working with. And so as part of our event, we had youth who visited many legislative offices, and those who were not visited, they went and did drop-by visits. And in the packets of the materials that were handed out, they shared a little bit of information from all of the priority population policy platforms that our 6 coordinating center partners created. So we were really excited to be able to highlight not only what the problem of commercial tobacco looks like here in California in our diverse communities, but also highlight the solutions that the different organizations and their partners have come up with for how do we really achieve health equity. And more so for youth to share their stories and to let legislators know what does the impact look like on their own community, and to invite legislators to be part of the solution and to really deny entry to the tobacco industry. And I just want to shout out that even though not all young people were able to travel to Sacramento, we know that some young people even met virtually, and really excited that youth partners and supportive adult partners from the LGBTQ Center in Orange County even met with one of their elected officials this morning virtually to really share the work that they're doing to address tobacco use within the LGBTQ youth within their area, and to highlight the incredible work that youth are leading in Orange County. So I will now turn it over to Isaias. Thank you so much.
No, that was great. Thank you, Kim. And one of our other policy recommendations that came through this process is a focus on LGBTQ organizations, more specifically community-based organizations who can play a very critical role in supporting community-informed and culturally competent tobacco control prevention efforts. Through this process, we've learned that LGBTQ organizations can serve as a place to provide cessation programming. They can provide support groups and referral services. They can also offer mental health counselors and other types of services and programming to help support LGBTQ people in preventing and quitting tobacco. So you can see how, based on the conversations we've had in the past, what Kim mentioned, and what Ian mentioned as well, as throughout these recommendations, a key player in all of these conversations is having trusted community partners, trusted community organizations who can help facilitate these conversations and provide that support to our communities and tobacco prevention efforts. We know that many people feel more safe with LGBTQ organizations and contacting LGBTQ organizations compared to other traditional direct service providers. And so that's why this is one of our policy recommendations. And so right now, LGBTQ organizations and community centers are not being funded or not being offered many opportunities to receive funding for different direct service or prevention, health prevention funding and opportunities, when we know that they are the trusted messengers who can provide community education, who can provide direct services. And so by funding LGBTQ community-based organizations, our communities, LGBTQ communities, can use these spaces not only to have access to direct services, but also to receive tobacco prevention education, to learn how tobacco affects their specific healthcare needs, whether they're trying to transition or receive gender affirming care, or whether they're HIV positive. These spaces can be a place where they can learn how smoking plays a role in their health. And these spaces can also be able to provide culturally competent messaging in order to prevent stigmatization, further stigmatization or shaming in their process of quitting tobacco and accessing care, preventative care. So there are multiple challenges and barriers that are facing LGBTQ people who are looking to receive care, including in California. LGBTQ people face barriers in finding culturally competent mental health services and direct and physical health services, especially when they're looking for providers who can offer, who either share their identities or can offer services that are tailored to their needs. So for example, service providers who identify as either transgender, Black, Indigenous, or who are LGBTQ person of color, it's often really hard to find those types of service providers. Another barrier that exists are costs to access mental health services and healthcare, getting access to health insurance. These serve as a second barrier to getting care. And when reaching to service providers, most, if not all, who meet the criteria of that individual are often at capacity, have too long of a wait time, or are just unaffordable. So finding providers who are accepted by a person's health insurance and billing those insurance providers, in addition to finding the criteria you're looking for, are all multiple multiple barriers in people's access to culturally competent care. And we know that LGBTQ people also have a fear of discrimination. There's a fear of being outed or a fear of being mistreated on the basis of sexual orientation or gender identity by the provider. And this serves as a major barrier for people reaching out and accessing care. And so by funding LGBTQ community-based organizations, these organizations can really play a critical role where LGBTQ community members can feel safe and receive care and receive referrals to either receive care directly or offer referrals to providers who are able to provide those services in a culturally competent manner. And that includes programs that cessation programs and tobacco prevention programs as well, as they quit using tobacco. And so we know that LGBTQ organizations are capable of adapting messaging that is culturally relevant. And these are some of the examples that we know why community-based organizations play a critical role. They're the messengers of the communities, and they're able to understand how to speak to LGBTQ people, whether it's from promoting self-care and mental health awareness as a framework to stop quitting, or thinking about quitting as a family challenge to create a healthy environment for the ones you love, whether that is with friends or a blood family or chosen family or your pets. There's different levels of culturally adaptable and relevant messaging that CBOs can play when they're being funded to provide these programming and services. We know that this messaging works, and CBOs can be effective in doing so. And so, in addition to funding LGBTQ organizations, they can also play a role in developing networks of competent providers. They can be a directory and a source where they can refer people to different services and programs. And so, again, it's reiterating and reemphasizing how without community centers and community organizations who are serving LGBTQ people, it's very difficult to address tobacco-related health disparities when we know that our communities are already experiencing all of these barriers to healthcare, and we know that community centers can play that role in addressing these disparities. And again, cessation and health programming and services can all be included at local LGBTQ organizations and nonprofit organizations, from intervention programs and mobile lung screenings and so on. So these are just examples of what that partnership can look like between CBOs and community members in tobacco prevention and education and cessation programming. And yeah, so that's the end of my section. And I wanted to check in with any of the folks here who may have any questions or comments on what we've discussed so far. All right, well, if there are no questions, again, if you have a moment to please fill out our eval survey, which Ariela, if you can share that in the chat, that will give us some feedback as to what you enjoyed out of this briefing. And if you want to learn more, you can also contact me as well. And again, I want to leave this briefing to share with everyone that, policy recommendation is about getting to the root causes of tobacco use and really understanding the social determinants of health and what is really leading our communities to use tobacco as a coping mechanism. And some of the recommendations we've laid out is just only a portion of what we've came up with in our policy recommendations. And so if you want to learn more about the full length list, the exhaustive list of our recommendations, you can go into our website at the California LGBTQ Health and Human Services Network, and you'll learn more about specifically what our recommendations were and our thought process behind how we came up with those recommendations and so forth. So this is just the beginning, and this is not the full exhaustive list. If you want more information, please contact me. My email is up, and you're more than happy to send me an email whenever you want. Great. All right, well, with that, thank you all for coming, and I really appreciate for folks making the time. And I want to thank everyone, other co-presenters, thank Assemblymember Ward and Alina and Jacob and everyone who supported in making this briefing happen. And thank you all for coming.